Good evening. Hi, it's Sarah here. Don't know who's out there just yet, but welcome to my live. It's my first live, so please bear with me. I never know where to look on my camera. I don't know if I've set it up right, and it looks like it's probably going to get dark in about half an hour, so the lighting might all be wrong, but that doesn't matter. I'm just pleased that you can join me. Well, I'm Sarah, and I'm at First Aid for Families with Intelivation. Hi, Alex. Hi, Lisa. Goodness, got someone over from Cyprus. Wonderful. So, First Aid for Families, and the reason I set up this group is so that we can just have a frank discussion about first aid. Now, with first aid, one thing I'd like to highlight is we're not doctors. We don't need to diagnose any issues, but what we want to be able to do is just to be able to support somebody, if they're in need of help, and sometimes we're just bystanders, and we might be the only one available to be able to help somebody. So that's what first aid is all about. My background, I'm not medical. I haven't got a medical background. I have a first aid background. I've been a first aid instructor for about 5 years now. I've been working with heavy industry, places like the railway industry, sort of teaching first aid principles there. But I also have a family, 2 little children, and they're pretty prone to bumps and bruises and things like that. Nothing too serious yet, great. But you just never know, so always be prepared is kind of my motto, although I never carry a first aid kit. So I must rectify that one. So I'll be interested to see if any of you carry first aid kits at all, and what actually you have in your first aid kit. So that would be nice to find out. So I've got some comments coming up, so that's great. So if you've got anything you want to ask, then please ask away. So that's great. Now, first aid, what is it about? Basically, it's to preserve life, alleviate alleviate pain, prevent deterioration, and promote recovery. As I said before at the beginning, you might not be able to fully diagnose what is going wrong, but if we can just deal with an incident very, very quickly and alleviate that suffering or prevent deterioration until the emergency services arrive, then we're doing a really good job, so don't be worried about it. I spend a lot of time in the classroom teaching first aid, and the biggest question on everybody's lips, hi Georgie, you alright, is at the end of the day, can I get prosecuted or sued for doing something wrong if I don't do it right? If you haven't been trained, then no. But we've also got a thing called the SARA Act, which is the Social Action, Responsibility and Heroism Act, which came out in 2015. And basically, that allows us to be able to help somebody without being worried about being prosecuted, because that actually stops people doing anything. And it might just take a simple move of a casualty into a recovered position that will prevent the deterioration of a condition. Hi Vicky, how are you? So if you've got any comments, then just shout and we'll look through those comments as we go through. So the comments are on the left hand side. There we go. Alright. So, reason I'm talking to you this evening, I put a post out, I think it was 2 days ago, with the pictures of my 2 children up trees. And I was thinking, what would I do if they fell? What would be my immediate reaction to that? Probably the first thing as a mother is a bit of a headless chicken action. But because I'm trained, I'm hoping that my training would override that and actually deal with any injuries. I did talk a little bit about head injuries and fractures, but today I just want to talk about the head injuries. Fractures we'll talk about another day, but today we want to talk about a head injury. Now, a lot of people, especially with children, I think the biggest thing that they think about is not allowing that child to go to sleep after any type of head injury. But if you've got an infant or a child that normally naps at around 10 o'clock, so this was before they had a head injury or a minor head injury, if that's their normal time to nap, then allow them to nap. That's absolutely fine, but stay with them and just monitor them for deterioration. But let's say we did have a head injury, then what we'd need to do is to sit them down, or lie them down, just raise the head slightly and then put a cold compress on there and hold it against the head. If it's a cut, and we all know that head injuries bleed an awful lot, so it's an awful lot of blood, but it's nothing too much to worry about. All we need to do is put something sterile, something clean, or as clean as you can, onto the head, put direct pressure on there, and that'll stem the bleed. So that's what we want to do, is to stop the bleed first of all. So monitor levels of responsiveness, so making sure that they're talking to you, keep communicating with them, you know, looking for alertness, responding to your voice, pain levels, you'll see that going up and down, and responsive to stimulation and things like that. So that's what we want to look for there. Okay. If it is a severe head injury and you have real concerns about it, then the only thing that you can do there is ring 999 or 112. Now 112 is also an emergency call number. Okay, so that will take you through to the emergency services, exactly the same as 999. It's just an international number. So if we've got someone in France, or if you're over in Cyprus, Lisa, I'm sure 112 would work over there for you as well. So it would put you through to the local emergency services. So they're the two numbers there that you can actually use. All right, so as I said, if there's a severe head injury, then yeah, just ring 999 112, and what you're looking for is responsiveness and making sure that that casualty or their child or whoever it is as comfortable as possible. So that's how we're going to like deal with head injuries there. Okay, but as parents, we kind of know when things are really serious, so use your instincts there, your gut reaction to it all, and if you have any concerns at all, then please seek medical advice. Other signs that possibly the head injury is worse than you first thought: increased drowsiness, persistent headaches, so the headache's not going to go. In a child that's quite difficult to gauge, but you're looking at the pain thresholds there. Confusion, drowsiness, loss of balance or memory, so that could be short-term memory loss, difficulty in speaking or walking, vomiting, so that would be quite a very clear sign that concussion is there, double vision, and then in severe cases seizures can happen, so people can fit. So what's concussion? You know, basically it's where the head's being shaken around a bit, and it could cause the brain to shake, and therefore you got maybe a temporary period of unresponsiveness. Okay, so some concussions can be really serious, others are very, very minor and just need monitoring there. So yeah, so we just need to make sure that we monitor the casualties there. I keep saying casualties, I feel like I'm back in the classroom all the time. So your patient, your child or whoever you are dealing with. But I think the main thing when it comes to first aid is just don't panic. Try not to panic. I know that's easier said than done. Like I have already described, I don't carry a first aid kit. I really think I should carry a first aid kit, but I don't. But sometimes when it comes to first aid, it's a little bit of improvisation and you know, using what you can to maybe stem the bleed. If it's sterile, even better, but sometimes that doesn't happen. For instance, I've got a friend, she was the first on the scene to a road traffic accident. I think it involved a motorbike, and the only thing that she could use to stem a bleed was a nappy, and she used it and it worked. So that was great. So it's nice to see you've got a couple of people jumped on here. So if you've got any questions, then just put them in the comments, and hopefully I can answer them for you. Just wait a minute there. No one likes to be first to ask questions. I get this in the classroom quite a bit. They'll sit there for a while. It takes about 2 hours to warm a classroom up to actually ask first aid questions. But remember, this is a nice, safe space, so it'll be great if you just ask away, and within the group just share any information. And if you've had any experience where you've had to deal with a first aid situation, then yeah, it'd be really nice to hear about it. And you know, sort of like you could reflect on maybe what you would have done differently, or you would have done the same thing. I don't know. So it'll be nice to see what people think there. yeah, and I'm always after a good first aid story. Always like it, and people do like to share in the end because it gives them a bit of confirmation that actually they did the right thing. And remember, with first aid, there's no real wrong way of doing it. But hopefully in this group I can share lots of information so that if you do have to deal with any incidents, then I can help you out. So I'm just waiting. Anyway, how was VE Day for everybody? Was it okay? I think I've eaten too much cake and drank too much tea today. There was an awful lot of cake floating around the village, so everywhere I went somebody was selling a cake, so we've had quite a nice time eating in the lovely sunshine and celebrating VE Day. Well, if there's no questions, then obviously pop them in the comments later on and I can answer them within the group. But it was nice speaking to you this evening. How long was that? It wasn't too long. I said I wouldn't keep you for too long. I'm sure you've either got some good TV to watch, or like me, I've got a pizza to make. Alright. Oh, Alexander, no cake or drink? Oh, that's a shame. You should have made a cake, Alex. Alright, I'll speak to you later. Bye. I can never find the off button, so bear with me.